Oh my word, I can see names that I recognize. It's so great to see you. And thank you for saying hi. Don't forget to tell us where you're at. Some of the people I see coming on, I know you and I know what state you're in, but it would be kind of nice to see where you guys are all from. This is one of my favorite subjects, as you know. If any of you guys have been following CCO for any length of time, which I've been right at with CCO for a decade. And everybody knows that ICD is my favorite code set. Part of it is because you're always learning. I love the disease process. I love everything that goes around the knowledge base that goes into the code set. That being said, that's my favorite code set and my favorite area to work in with the code set is risk adjustment because again, it's exclusive to ICD and you get to see the entire disease process as I mentioned, and you get to see a year's worth of documentation for a person, not just one encounter here and there. So you kind of get to see the overall patient complexity and severity and how patients get better and the treatments that work. It's very exciting. So every year, not only is fall my favorite time of the year, it's also because this is when the ICD changes drop. Mm. Now, I like the way that we present our ICD-10 updates because we don't just tell you, oh, this is the new code, they revised this one, they deleted this one, and just read off the codes. No, I like to do research about the new codes as I go along because it tells me it teaches me, and there were several things that I didn't know about that I looked up for this code set change, and I'm excited to share those with you. I think that when we do that, that gives us the better ability to understand why they made changes, why they added new codes, why they changed verbiage, or why they deleted codes. Now, most of the time, the reason that they delete a code is because they add a code. They just don't say, hey, we're not going to use that code anymore. I don't want to forget to tell you guys that if you want to get the transcript as well as the slide deck and the video for this presentation, you can do that on the CCO Club. But we really want to have you guys give us likes. It's apparent that YouTube likes likes. And so just take a moment right now to go in and hit the like button for us on the YouTube channel. Our YouTube channel is Medical Coding Cert. And again, this helps us. It allows us to stay on the platform to where we can reach more people. This is all free content that we give you. Again, lots of people do the ICD and the CPT updates, but we just as soon give it to you free because it actually, if you've got access to an encoder, you probably have access to it free. But you don't have somebody explaining the changes and why they think those changes were made. So again, push the like button for us. And also, there's a subscribe button, so feel free to do that. And there's a little bell. And if you click that bell, then it'll tell you every time we do a video. We like to do those on Tuesdays, Wednesdays, and Thursdays most of the time. And again, we'll put those here on Facebook so that, or excuse me, YouTube, we're on Facebook too, so that you can get that content free. So we appreciate that. Let us know that where you're from, that you like it, and feel free to share too. So the new codes this year for ICD, there was only 159 new codes. This is significantly down from the last few years. Last year, there was a couple of areas that really got hit hard with new codes, which I know there was a lot of stuff with eyes and ears. And off the top of my head, I'm trying to remember what some of the others were, but I remember that was significant. So that, that's kind of fun. Now, there were only 88 codes that were changed, and most of the time that's just verbiage, very simple verbiage to better explain the definition of the code. And there was only 32 deleted codes. Now, those deleted codes, I'm going to show those to you in the encoder that we really enjoy, and that's Find a Code. Don't forget that there's new guidelines. So whenever you look at a code and it's a brand new code, there's probably going to be a guideline associated with it. Some of the guidelines I put on the slide deck so that you could see them, but we'll go over the changes in the ICD 2022 guidelines in another webinar that will bring you here free and allow you to ask questions. But again, pay attention to that. So the way we set this up, and this works really well for me because I'm an audio visual type learner, but I like to color code things. So anything in green is going to be a changed code. Everything in black is new, and blue are deleted codes. But for the most part, we're going to be dealing with the new codes. All right, the first code. I kind of got tickled when I saw this because the tick, the new code from last year, there was more than just one A code, but this time there's only one, and it had to do with a tick also. So this is anaplasmosis, and it is transfusion transmitted, but what it is it is something that the body gets from a tick, and it's actually worse than Lyme's disease. So this website that I got that statement from was called mosquitosquad.com. I thought that was a brilliant name, and I think you should go and check them out. All right, so really there was only one new code, A79.82, anaplasmosis. Then we don't have any B codes, so we skip straight into the C codes. The C56.3, we have a new code that explains a malignant neoplasm of bilateral ovaries. Now, it makes sense to me why they would have done this, because in the past it just said ovary. So now we're saying not just the ovaries as a whole, but I mean, if you have one ovary, or you had the left or the right, you would have to distinguish that. Now you can say both bilateral have abnormal malignant cells. And then because of that, the C56.3, then they have to add secondary. So C79.63, secondary malignant bilateral ovaries. Now, again, when you remember that whenever they add a new code in the cancer neoplasm table, then they're going to add a primary, a secondary, maybe a benign code, which is going to be an end of the C codes and into the D codes, or the other two columns, unspecified behavior and such. So when you get a new code for the neoplasm table, it's probably not going to be just one unless it's very, very specific. And again, this makes perfect sense why they would add the C56 code 0.3, because we want to say that both ovaries have cancer, and then the C79.63, which is secondary. Now, this is really important with risk adjustment, because secondary malignancies have a higher HCC and RAF score than primary malignancies. And ovarian cancer actually is one that likes to metastasize. Now, so I would think that a lot of times it's a primary cancer, but that isn't always true. So just the disease process that I'm aware of. But ovarian cancer is one of those ones that if they don't catch it early, it really likes to metastasize. So there's a really interesting, another new one, C84.7A. Now, this is a lymphoma. This is an anaplastic large cell lymphoma. But what is interesting about it is they have linked this to breast implants. And I think, if I remember right, don't quote me, but I think there was a specific breast implant that they found that linked with this particular type of lymphoma. I could be wrong, but I know several people that have had breast cancer, and some of them had had implants, and they did a lot of research to make sure with their reconstruction that they got a good implant. And then they were very frustrated to find out later that one of the two people had had a specific time they thought had no complications, and they found out they did. That particular one did, and this may be the diagnosis that was linked to that. I don't know for sure, but it's important to note. It says, hey, use an additional code if applicable, breast implant status, meaning that, okay, it would make sense that you had C84.7A. That means that you had breast implants. So Z98.82, which is not a new code, would be applicable to tell the rest of the story, or that you're a Z98.86, that you had had the implants already removed. So a personal history of breast plant removal. So again, uh, good information. Then we jump right into the D's. It's interesting to note, though, just as you learn the ICD code set, C's are all cancer codes. And as you get to the end of the code range for the C's, then it starts turning into like the benign and uncertain behavior and so on and so forth. And it kind of goes into the D's. But also, D codes are anemia codes. So D55.21 is new. It's anemia due to pyruvate kinase deficiency, or PK deficiency anemia. I think that sometimes you guys come and watch me just so that you can see how I torture verbiage and pronunciation. So again, haha to me if that is the case, but I do my best. Now, the D55.29, that is anemia due to other disorders of the glycotic enzymes. And then it goes on to name two that would be applicable with that. If you don't know what PK is, I did a little research, and pyruvate kinase enzyme actually breaks down a chemical compound called ATP. And that when you don't have that enzyme, then there's a lack of the ATP, and then you get what they call dehydration of red blood cells and abnormal red cell shape. So I thought that was really quite fascinating. And then it went on to say the altered red blood cells has a shortened lifespan, leading to hemolytic anemia. All makes sense with the disease process, right? All right. So with our D codes, D75.838 is other thrombocytosis, and also D75.839. As a general rule, with the code set, eights tend to signify other when it's after the decimal. That doesn't mean it's actually true all the time. Don't want my throat drying out early. Okay, and nines tend to be unspecified. Again, not always the case. There is some codes I can think of specific when that rule doesn't apply with diabetes and complications. Sometimes that's a little wonky. But again, when you see an 8 after the decimal, most of the time it's an other, and nines are usually unspecified. That'll help you with testing if you are trying to rule out codes. Now, another thing to keep in mind is that if your provider states other, meaning they use an other code, if they're able to, they need to define what the other is, or at least document what the other is, because other is defined by the code set as, we have specificity. I know what it is. There's just not a code for it yet. And that would be other thrombocytosis, whereas unspecified thrombocytosis means that we don't know yet. either wasn't documented or we don't know. We still have to do more testing to find out. What actually is thrombocytosis? It's a disorder in which your body produces too many platelets. And you can imagine how difficult that would be, especially in an older person, because their arteries already are starting to lose that elasticity and filling up with sludge. And so, again, to have more platelets and that gets caught, and then you can see how strokes and things like that would happen. So then we move on to D8 9.44, hereditary alpha tryptasemia. Tryptasemia. I may not have done that right. It's the most abundant mediator stored in mast cells. Now you have to know what mast cells are. I'll let you look up what mast cells are. So I remember studying that in biology. Ultimately, what happens is we can end up getting anaphylaxis reactions if that happens. It can be complicating. Now we get to jump straight to E codes. E codes, if you need to remember what the E stands for, then we like to remember it as that's your endocrine codes or your gland codes. Your diabetes, as well as, well, you got multiple glands in the body, but for the most part, think of E codes as glands and diabetes and endocrinology. This is an interesting one. E75.244, Niemann-Pick disease type A and B. Now, this is actually inherited. It's a multi-organ system, has symptoms that can worsen over time. I think I read that around 40 is when this can come up. I could be wrong about that. So they abbreviate this as ASMD, and it can affect the liver, lung, spleen, blood, and digestive system. So when a person is an E75.244, then they're probably going to have comorbidities with these other organs that you'll see in the documentation. Jumping all the way into F codes. I remember F codes as your feeling codes. F32.A is depression unspecified. Now you think, wait a minute, we've been able to code depression. Yes, we have. Well, what they did was they made this an F32A versus what we had before. So you're going to see that there are some F codes that were deleted. It's going to be just depression unspecified. And then F78.A1, and this is a genetic disorder that ends up happening with patients who sometimes have epilepsy or some other type of neuro disorders. And it made a point to state that if applicable, then if they're on the autism spectrum, they have had encephalopathy, epilepsy or recurrent seizures, other pervasive developmental disorders, all of these would be coded with F78A1. Again, it's a good idea. We don't just learn these for ourselves. Remember, we may need to be educating the rest of the people in our team about these codes that are now available to them, as well as providers. And Gigi said, did you say E code for diabetes and what? Glandular, anything that has to do with a gland, like the pituitary gland or the thyroid. Those are all types of E codes, as well as things like malnutrition end up being an E code. The other one, and obesity is an E code. So F78.A9 is other genetic related intellectual disabilities that you can use. So What about this? I'm going to say it's called SYNGAP just because that rolls off my tongue. SYNGAP 1. I did a little research and it said related to intellectual disabilities and a neurological disorder characterized by moderate to severe intellectual disabilities that is evident in early childhood. And then it goes on to state that it could be speech, motor skills, sitting, standing, and walking. Again, this is something that's tracked in early childhood. If you've had children, you remember that they probably did all of this tracking. The Your pediatrician wants to know, when did they start to hold their head up? When did they start to sit up? When did they crawl? When did they walk? Et cetera, et cetera. And I have a son, you guys know, that is epileptic, and he has intellectual disabilities. They're really unique, and we could, since this is a code, I remember Uh, his neurologist stated that they found something genetically. They just recently discovered something, recently meaning that could be like 5 years, but that, yeah, early childhood development and stuff like that, he might be applicable. This could be one of the things that he was talking about. When the codes first started to drop, I noticed this and thought, oh, yeah, I'm going to ask the neurologist if this is actually what he meant. So, kind of fascinating. It's not like they can do anything about it. Well, he did actually say there was a medication now that they think that would treat that. So, yeah. Hey. All right. So, now we're going to go straight into G codes. G codes are what I like to remember as little gray cells. Do you remember Agatha Christie had a character, Hercule Poirot, and he wasn't French. He was Belgian, and he would say, "Oh, the little gray cells. I have them working very hard today." And again, we call them gray cells too. That is the correct verbiage to use, the gray cells. And or you can think of ganglion, which are part of the nerves and stuff. So these are nerve codes, whether they be the CNS or the PNS. GO 4.82, acute flaccid myelitis. Now, flaccid, that's not a word that you hear every day, but ultimately what it means is that it is flappy. And myelitis means you have inflammation of the muscle and you don't have good muscle tone. Then G4 4.86 is cerviogenic headache. And this was something that could be associated to spinal conditions. So that was interesting. I had not been aware of that one either. G92.00, immune effector cell associated neurotoxicity syndrome, grade unspecified, is G92.00. And just like our N18 codes for CKD that have stages, the two characters behind the decimal is going to give you what grade it is, and it goes all the way to 5. So I didn't list out all of those codes because that's kind of a no-brainer for you. Now, with this G92.00, I thought it was fascinating, so I went and looked it up, and it's actually a neurotoxicity syndrome they call ICANS, and ultimately it works. It ends up happening after people have immunotherapy. Sometimes they get this ICANS. So that was interesting. You can do more research on that. Going on with our G codes, G92.8, other toxic encephalopathy, toxic encephalitis, metabolic encephalopathy. This is just a little scan of encephalopathy. Ultimately, is fluid and irritation and inflammation to the brain and the nerves. But if a patient has G92.8, it could be applicable if there was a drug or toxin that caused that. So we would use a T code to identify that. And then it also says, hey, if there was an adverse effect, make sure that you note that. And then G92.9, unspecified toxic encephalopathy, which again, we know what that means. So what is toxic encephalopathy? It's actually being exposed to something that gives ranging from subclinical deficits to clinical disorders, overt clinical disorders that can happen to the person. Now we jump all the way into I codes. I like I codes because I think of them as I heart you. You know, you have to see that little logo, and I codes have to do usually with the heart or the circulatory system. Mm. Now, this code, I5A, I suspect we're going to use it quite a bit. Now, we all know the codes for an MI and an old MI, acute, and then we can do STEMIs and non STEMIs and all that other stuff. But this code is a non ischemic MI or non traumatic. So I had to do a little research to make sure I understood exactly what that meant. And so, what does it mean to have a non ischemic, meaning it's not the heart having a blockage per se that causes an infarction or death of the tissue like we normally think? What happens is you get death of tissue, right? But it's the cardiomyocytes, and they have an elevation of the cardiac troponin values. Now, this is a chemical level. So I like to tell people that our heart is muscle. So we've got the muscle component that we mostly talk about, but there's an electrical component of the heart because we have the SA and the VA node, right? But then we also have a chemical component of the heart. If you have too much calcium in your system, it'll make your heart, and magnesium. And again, that all has to be regulated. And that's what this is this troponin. Um, Now, it is interesting to note that if the person has a non-ischemic myocardial injury, that is kind of like a prerequisite to, hey, now they could possibly have a myocardial infarction. So again, notice that because of this I5A, all the code firsts that could be applicable, that could be causing a non-ischemic, non-traumatic uh, injury to the heart itself. So that was fascinating to see all of these conditions. K codes. K codes I think of as with the digestive system. I remember it because of the commercials for Special K to make you lose weight or to help you with your digestive system. And so I'm not sure if that's the way you remember it. I'd be curious to see how you would remember what K codes do. So this is this what I did, you'll notice here. So first we have K22.81, 82, and 89, esophageal polyps. Now, again, we really couldn't identify that in the past, but not only do we have an esophageal polyp, but we have an esophagastro uh, junction polyp, so where the esophagus and the stomach meet, and then other specified disease of the esophagus that aren't, a polyp. However, if we use other, then we have to identify what the other is in the documentation. Or again, you might sometimes you use a code to identify what the other is. So again, that's the 822 codes that are new. And then look at all these 831 codes. Now, instead of doing spelling this all out again, these are gastric intestinal metaplasia. And what is that? It's actually abnormal change to the nature of a tissue. So there's change to the gastric intestine, and then it just leads into further description. So K31.AO is unspecified. Now, if you don't know medical abbreviations, that /S means without, it's Latin, and the C is with. So from A11 all the way to A19 is without dysplasia, but we've got involving atrium, the corpus body, fundus, cardii, multiple sites, an unspecified site. And then A21 is with low grade dysplasia, high grade dysplasia, and dysplasia unspecified. And Claire says, how can we find out if any of these new codes will risk adjust? Well, actually, I was going to look those up for you. And so if you make a note of one of the codes you want to see, we're going to jump in to find a code, and we'll see if they've identified it yet before it goes into the full version of the code set. And again, just being able to look them up on the encoder will tell you if they carry an HCC or not. So we'll do that for you. And now we go into the L codes. All right. Uh, Daniela wants to know: is there any new H codes? Well, you have to hang on. We haven't got there. Or wait, no, did we? No, there's no H codes. Now, H codes last year. If I don't have it up here, that means there was no changes. Very good, Daniela. I'm sorry. I should say, well, we haven't got to H yet, but we did. We passed it. HIJK. So then we go straight into the L codes. And yeah, there is a list of the new codes. I'll show you how to find them on Find a Code when we get to the end, Lisa. All right, so L24.80, it's an irritant to contact dermatitis due to friction or contact with body fluids, unspecified. Now, that is the definition. And then when you look at the others, I went ahead and took out that main part of the definition because it's actually just a bunch of verbiage we don't necessarily need. So L24.A1 is due to saliva. So we have irritant contact dermatitis due to friction or contact with saliva. And then A2, fecal, urinary, or dual incontinence. And then A9 is friction or contact with other specified body fluids, endotracheal tube, wound fluids, exudate. Now, again, when your provider is going to use these codes, we need to make sure they know first that these new codes are available to them, but also that they need to document that's what the irritation is from. Okay, then we're going to go to L24B0, which is unspecified stoma or fistula. So again, this is irritant contact dermatitis due to, all the way down to the comma, related to that unspecified stoma or fistula. So they're not telling you where the stoma or fistula is. And then B1 is digestive stoma or fistula, thus gastrostomy, duodenostomy, saliva or spit fistula. Now, when I read that, I had never heard of a spit fistula, and I'm sorry, I started to laugh, and I thought, you've got to be kidding. I've never heard, is that a thing, spit fistula? And so I looked it up, and I was going to give you a picture of it, but it was mostly like babies that had that, and I thought, oh, it looks so sad. But ultimately, they reroute, and it allows the mucosous membranes, I guess the spit goes into a little bag that looks like a that like you'd have a stoma and a gastrostomy here at your throat instead of in your abdomen. So that was kind of interesting. But then we've got respiratory stoma, which would be a tracheostomy, and then fecal or urinary, which would be colostomy, endocutaneous fistula, or ileostomy. So again, that was something that I had learned, and I had a little giggle right there. It's like, spit fistula, really? Is that a thing? And it is. Now we jump all the way to the M codes. M31.10, thrombotic microangiopathy unspecified. So I had to stop there and think, wait a minute, what was microangiopathy again? And then I went and found this graphic, which says it's actually on the cellular level, and it says, it's just a disease of very fine blood vessels, is a thrombotic microangiopathy. And then for 0.11, we have hematopoietic stem cell transplantation associated, same thing, which is HSCT-TMA, because nobody wants to say that or write all of that. And then M31.19 is the other, meaning you need information like the I used to call this purpurea, but it's not. It's purpura. This is how you say that. That does not roll off my tongue easily. So still with the M codes. Now, this particular word is one that I had to learn last year when I was talking to some specialty providers, and I really had a hard time remembering it because what I wanted to say Georgian or something like that, but it's actually pronounced Sjogren. And I went ahead and put Sjogren there above the picture so that you would know how it is pronounced. So Sjogren, and I always wondered where that's from, and I think I looked it up last year, but I can't remember. So M35.05, Sjogren syndrome with inflammatory arthritis. All of these are with. So you have point 6 is peripheral nervous system involvement, 7 central nervous involvement, 8 is gastrointestinal, A is glomerular disease, B is vasculitis, and C is dental involvement. And ultimately, what this is these glands that are in your tear ducts and in your salivary glands. They don't work properly and they get very, very dry, and it causes a lot of complications and stuff. But I think there's some treatments that they can use that help. But again, it was really a fascinating disorder, and it does risk adjust, by the way. Uh, okay, so more M codes. There was a lot of M codes this year. That was the heavy hitter this year was M codes. M45.80, non-radiographic axial spondyloarthritis of the unspecified sites in the sites in the spine. Try to say that 3 times really, really fast. Okay, so ultimately, what this is spondyloarthritis isn't something that just shows up very easily. It is an inflammation. When you have arthritis, if you look at people's x-rays, sometimes they're going in, they're having a chest x-ray, and they're looking at the lungs, but the radiologist will mention that the patient has cervical osteoarthritis or something like that, meaning they can tell that there is a problem with the joints of the spine, different places and stuff like that. They mention the heart and whether it's too big or too small. But so everything they see on that image, they mention whether that was the reason that they had the x ray or not. And so you'll often see arthritis is mentioned on an x ray. But what's this spondyloarthritis is really hard to see on an x-ray, and sometimes they'll go ahead and have an MRI to have that done. So with all these M45 codes, M45A, they've actually listed out the regions so that you could see. So one is occipital, at latinoaxial region, that's up here. Cervical is a 2, 3 is cervical thoracic region, 4 is thoracic, 5 is uh, thor, thor, uh, thoracolumbar region, another word that I have a trouble saying. Lumbar 6, lumbar sacral 7, 8 is sacral and sacral coccygeal region, and B is multi sites in the spine. Now, what that means is that if you have multiple that are listed, you can just use M45.AB. You don't have to list all of these out, which is really nice. Okay. M54.50, low back pain unspecified. Now, this could be loin pain or lumbago. Now, we've had lumbago before. There's a code for low back pain. So I thought, wow, what they must have uh, added to that to make it to use that. So actually, what it was is we had lumbago, but we didn't have anything else. So now we have lumbago, which is M54.50. I think it was just a 5 before. And then 0.51 is to go with the vertebral ogenic low back pain, which is the end plate, which I went and grabbed this graphic so that you could see where that vertebral end plate was for each spinal, each vertebra. And then 0.59 is other low back pain, which again, have the provider specify what the other means, and that doesn't fall in this code range that we can use. And then a definition about that in plate. It's a good minute to just take a break and say, how many of you guys have hit a like button for us? We really appreciate it. If this is valuable information, if you're having a good time, if you think that this is something that you would like to see again and again and again, then click the thumbs up for a like, and that will help us be able to keep providing this information to you free, because we really enjoy doing that. Now, if you want access, we're not done. We're just about halfway through. If you want more information, like you want this transcript, you want the video as well, and you want to be able to ask questions about this particular uh, uh, webinar. Again, we have conversations over the cco.us/club. That's where we do a lot of exclusive stuff. It's really a minimal monthly investment, and I guarantee you spend a whole lot more on coffee in a week than you would spend on the club. If you did, Susan said she went and hit the thumbs up. So thanks, Susan. Anybody else? So just take a breather. I'm going to take a deep breath and keep going. Mm. I have so much fun doing this, and I'm trying to, I don't normally talk quite this fast, but it's a lot of content. And I think in the past we've done this like in 4 hours, and I don't want to keep you guys here that long, although I could. Uh, so again, if you need a little break, that's fine. Just tell me, do you guys need to take a break or just keep going? Just say keep going if you want me to go. And if you do, I'll just read the slide out. That'll give you a chance to go take a bio break or get a sippy of your iced tea. Kay went and said that she passed her CPC exam and she got results yesterday on Christmas Eve. This wasn't a month ago. I think this was from a previous. She's so excited. Thanks to CCO for your help. Couldn't done it without you. Brittany said, I feel like I had everything I needed to successfully pass the CPC exam. Gina said, without the BAT system and the Blitz, I'd never have accomplished this on my first try. So that one was a year ago. We really appreciate our members, our students, and the other people that are behind the scenes that keep CCO running so smoothly. If you want to see up-to-date testimonials or give a testimonial, you can see that you can go to cco.us/testimonials. Or if you are thinking you want to test, absolutely go to the website at our cco.us/CCO-proven-process. That's where we talk about all the things that you need to pass any of your credentialing exams. So thanks, Sarah, for saying that you love these videos. We love doing them, even behind the scenes working on them. We've been doing it so long that it doesn't take us long to produce this content for you. So thank you. Mm. Okay. Oh, Sarah says the BAT system and Blitz are a huge topic on the AAPC Facebook page. Well, thank you for saying that. It really is Laureen came out with the BAT technique back in the 90s, and she's been teaching it ever since. And that's how she created it when she needed to take her exam, the CPC exam. So she's had her since the 90s. So, okay, well, let's get to moving on. We have more letters to go through. And looks like they said 81% of people want to keep going. Okay, good. So P codes, how do you remember P codes? Well, first we missed O codes, right? O codes are obstetric codes. P codes are for baby pediatrics. So P00.82 is a new code for newborn affected by positive maternal group B streptococcus, which is GBS colonization. Or it could just be that, in other words, they're saying your contact with positive strep B, that the babies had contact. P09.1, abnormal finding of a neonate screening for inborn errors of metabolism. Now, I don't know why that says inborn and not newborn, but maybe it does say inborn. Don't take that with a grain of salt. I've never heard of the term inborn, but again, so all of these codes, these P09 codes, you've got 2, 1, 3, and 4. Each one of those are for abnormal findings of a screening for a neonate. The 2 congenital endocrine diseases, and the examples that they tell are applicable are adrenal hyperplasia or hypothyroidism. And then the 3 is congenital hematological disorders like hemoglobinopathy Biathanias screen. I don't think I said that right. Red cell membrane defect screen, sickle cell screen. And then 4 is for cystic fibrosis. Again, that's really great that we're able to identify these are found on a screening, abnormal finding on a screening. Then we move into 5, which is continuation from the previous screen. So I went ahead and put the definition at the top again: abnormal findings of neonatal screening for critical congenital heart disease. And that would be any type of congenital screening that they failed for the heart. The 6 is for hearing loss, but I did put the excludes 2 on here. That means hard stop. Z01.110 is for a hearing examination following a failed hearing screening. That is not the same as abnormal finding on a screening for hearing loss, P09.6. Don't get confused about that. Those are 2 different ones. The 8 is other abnormal findings. And of course, then it needs to be identified what the other is in the documentation. And 9, neonatal screening unspecified of abnormal findings, meaning we don't know the results yet, or it wasn't documented for us yet. R codes. R codes are signs and symptoms. Now, again, some of us old timers that used to have to write and read the handwritten documentation, which you don't see as much, S/SX, or is that forward slash? I can't remember. That stands for signs and symptoms. I was actually watching a video with Dr. Schmidt, who is gastroenterologist that we had on the CCO. We interviewed him. He's got some really funny videos. Go look at DOC Schmidt on YouTube. And he had done a video on abbreviations, ones that he liked and didn't like. And quite honestly, doctors nowadays don't have to write this stuff out like they used to. They literally type it out. So they don't use the abbreviations like they used to. And he was saying ones that, well, he still sees these. And I kind of thought for treatment, TX, fracture, FX, things like that. He goes, I don't really, like TX for treatment. And I thought, we used to use that all the time. Anyway, enough said about that. I'll give him a hard time. R05.1, acute cough. Now, in the past, what did we have? Cough. Now, why do you think they busted out the cough codes to give them higher specificity? A cough is a cough, right? What do you think? Put in the conversation in the comments. Why do you think that now we have more descriptive codes for a cough? Barbara nailed it. Bam, first one. Kudos to you, Barbara, for you should get a gold star. COVID, Mia Lamb. Yeah, of course. So coughs definitely have been in the mainstream. Yes, Lisa, that's right. Sarah nailed it too. Flu versus COVID. So whenever anything is happening in the disease process, or why else did we get a new code? U codes never existed before. We do have a new U code, by the way. And the codes we code for statistical purposes. It happens to be a convenient way to get paid. So statistics needed to reflect the different type of a cough so that it could go along with the disease process. Like Sarah said, is it the flu? Is it COVID? Because we'd be able to describe it. So point 1, acute cough. 2, subacute, and 3, chronic. And a chronic would be persistent, refractory, or unexplained cough. 4, cough syncope, which means you fainted. You coughed so much that you fainted. I did this one time. Now, I grew up with asthma, and every year around the fall, my favorite time, I love the fall, but my lungs don't like the fall. So I usually lose my voice about a week. My husband always says it's 2 weeks if he's lucky. And sometimes if I would end up getting bronchial pneumonia. One time I was coughing so bad in bed after I'd already had my high-powered prescription cough medicine that I sat up. I was coughing, trying to catch my breath. I saw stars. Everything went black. And I thought, just in the back of my mind, oh my gosh, are you going to die coughing because you can't breathe while you're coughing? And then I finally was able to take a big breath. And then that's when I knew, okay, yeah, you've progressed into pneumonia. And sure enough. So, um, again, if you are going to code RO 5.4, if applicable, then you're going to put R55, sync that you collapsed. RO 5.8, other specified cough, then you better specify it. And 9, unspecified. Thank you guys. We just found out we hit 100 likes. Great. That's because you guys are so smart. You're already catching on with all this. JB says they're not using TX anymore. What are they using? They don't abbreviate anymore, JB. They type it out, right? And I can't tell you, like, obviously, maybe you must be old school like me, and you know that I still have trouble writing letters to people because I still do write handwritten letters. I send letters out all the time, cards and stuff. And I still have trouble not doing medical abbreviations when I write. So let's go on with our R codes. R35.81, nocturnal polyuria. And don't confuse that with N39.44, which is nocturnal enuresis. Okay. And don't get that confused with emesis because that's throwing up. So R35.89, other polyuria, 0.88, non-suicidal. Oh, wait, back up. That's not into that code, which R45.88, a new code, non-suicidal self-harm. Now, I always wondered about that because we did have a code for self-harm, and it was kind of always linked to, that's what they would use for suicide attempt codes. But that's not always applicable. So I'm really glad they add this because, again, there are a lot of people out there that do injure themselves purposely, and they don't intend to kill themselves. They are just hurting, and that's how they deal with that. And there's a bunch of psychological aspect around that. But R45.88 means they have inflicted injury upon themselves, but they're not, it's not with suicidal intent. And then make a point that if your provider does state that you're going to use this R45.88, that this code is available to them, then they need to identify the injury that the patient inflicted upon themselves, like cutting or burning or whatever, sometimes pulling out hair. There's different things you'd have to go in and study that. Those would be F codes probably involved. R codes. This graphic, this picture just tickled me to no end, and it is because of R63.39, picky eater. How many of us were either a picky eater, I was not, or have a child or a grandchild that's a picky eater? And this little girl's face just melts my heart, and I wanted to say, don't make that child eat anything she doesn't want, not with that face. So R63.30, feeding difficulties, unspecified. So for whatever reason, and don't think that this has to be pediatric either. Feeding difficulties. This can happen with older people, whether they have problems with their dentures or they're had a stroke, things like that. There's all kinds of reasons to use R63.30. So put 3.1 is pediatric feeding disorders, acute. 3.2, chronic. And 3.9, other feeding difficulties, feeding problems with the elderly or infant. So there's not an age specified there. It's the whole spectrum. And then picky eater. Just tickles me. So I want you guys to see this sweet little girl's face every time you think of R63.39. R79.83, abnormal findings of blood amino acid level, like homocystinemia. And but don't get that confused with amino acid metabolism, which is an E70 through E72 code. Metabolism, malnutrition, all that stuff are E codes, endocrine codes, by the way. And Sarah says, would love to have code all external cause codes like laceration at home in the bedroom. Yeah, well, you could Yeah, you're right. They didn't add any of those this year like that. No, I think they've about expelled everything that they could, but you never know. All right, so again, that's just the most adorable little face. You know what? Yeah, oh, let me go back. I just had a thought. This needs to be a t-shirt. R63.39, picky eater, and then have like broccoli or something on the t-shirt, right? Which reminds me, I have my CDI kitchen. Thank you, Baylor Scott and White, for sending me this lovely t-shirt for CDI week, and coders, all the coders got that. So thank you guys. Now let me make sure. So that is our R. S codes. We have there was no fractures and stuff. That's all been taken care of and added in the last couple of years, really updated. This time they went with traumatic brain. So the first thing I want to tell you, the reason you see some codes without description is because the codes are the same. But remember, whenever you have an A at the end of your code, that means initial encounter. So that means you have to have a subsequent and a sequela, right? So you notice there's a D and an S. And I just went ahead and listed the D and S. I wasn't going to write those out because that's redundant. You guys are smart enough to know all of this. So SO6.AOXA, initial encounter, traumatic brain compression without herniation. Again, this is a brain compression, and it can be traumatic brain compression or cerebral compression, but without herniation. Now look at SO6.A1XA is with herniation. And notice again, it has the brainstem, cerebral and cerebellar compression, and then you have initial encounter, subsequent encounter, and sequela with those. So you're going to see anytime you have one of those characters that at the end is a letter, then know that you're going to have multiple codes applicable. Now, I went ahead and put these, spelled these out because we have poisonings, we had adverse effects, underdosing, and then they have intentional assault, undetermined, adverse effects, and underdosing. So again, I wanted to just kind of highlight, hey, heads up. But notice what these T codes are for. T40.711A, cannabis. Why do you think we have all of these cannabis codes now? They didn't get them last year. They did add one cannabis code, or a couple cannabis codes, I think, last year. But what is it, guys? Put in the comments. Why do we have all of these codes for cannabis? Because we have to keep the statistics, right? What else? Wake up, wake up. We're almost done, guys. We're at the T codes. So, because cannabis has been legalized. And so that's right, Claire. It's legalized in so many places now. Well, if you have legal substance use, and it doesn't matter, tobacco, we got all kinds of codes for tobacco use, and alcohol, all of them, it doesn't matter. It means that we are able to statistically capture how that's affecting our patient population. No brainer. So again, T40.711A, poisoning by cannabis, accidental or unintentional initial encounter. Now, again, every time you see an A, that means you also have the same code. That's a D, which is subsequent encounter, and an S, which is a sequela. And I did not write those out. So when you ask, well, how come we have almost 400 new codes, or however many new codes? Well, because you get 3 codes every time you mention one code that has an initial encounter. All right. Now, 2 is intentional self-harm. 13 is assault. How do you define assault? Meaning you didn't ask for it, somebody gave you the cannabis. For me, that would be, it could be assault because I'm actually allergic to hemp, and therefore cannabis as well. And with asthma, you don't want me to get anywhere near it. I skin tested when they did all the skin testing, and the guy said, you don't well, back then it was illegal, but and it's like, absolutely not. I can't breathe with a cigarette, let alone. But again, so I can't use like lotion. Sometimes lotion has hemp in it and stuff. So again, I better not get one of those fancy brownies. Okay, so you have assault, meaning somebody gave me a Gumby or uh, one of those brownies. Sarah says, "Can you explain the difference between unintentional and intentional? I feel like many coders have their own outlook on this." Absolutely, good point, Sarah. Let's take a little sidebar there. So, uh, intentional, meaning that they intentionally tried to harm themselves. Okay, that was the thought process. So, cannabis, again, we have a hard time thinking, well, what can cannabis really do to a person besides eat your brain cells? Well, it can. It is a suppressant, right? So you wouldn't eat. And if you ingest enough of it, you can, it will stop body systems. Your liver has to process this. So anybody that has any like cirrhosis of the liver, liver damage, or anything like that, hepatitis, and they use cannabis, your body can't process that. And so to use that, you're intentionally harming yourself unless you were ignorant in the knowledge that, and ignorant I mean lack of knowledge, meaning that you didn't know that it would hurt you. But again, intentional, meaning yes, I'm trying to harm myself. Unintentional, I didn't know and I wasn't trying to harm myself. Or somebody gave it to you with the thought process that they didn't know, but still it would be classified as assault. Undetermined is a 4. 5, adverse effect, which is different than a poisoning. So go back and study poisonings, adverse effect, and underdosing. You have to know what the difference is in those 3 things. That's pretty basic coding principles. And you would definitely, if you're getting ready to test and stuff, those are 3 things that you need to be aware of. What's the difference between a poisoning, adverse effect, underdosing, and so on. Okay. And Jane said intentional pregnancy is an example. Yeah, I guess that would be, you could say unintentional and intentional. If a provider does not specifically document that, would we fall back on a certain code? Well, it's undetermined. We don't know, right? It's the same thing as unspecified. And oh, thank you, Deanna. I've been doing this for a long time, so it's like I get to regurgitate my knowledge. You're welcome. Okay, so let's see, where were we at? So we have 5 is adverse effect, 6 is underdosing. We're still talking about cannabis. And notice then 0.721A, we start over. So now we were in the 10s, now we go in the 2, and we start over with cannabinoids, synthetic cannabis. Yeah, sure enough, it's a bad thing too, right? It doesn't matter if it's real or synthetic, it still has the same effect. So we have to start over. So we're, again, initial encounter, subsequent sequela, and we start with poisoning. B is 2-1, 2-2 is intentional, 2-3 is assault, 2-4 undetermined, 2-5 adverse effect, and 2-6 underdosing. Yeah. All right. Very good. And I think now we're going on to T80.82 XA, complications of immunofactor cellular therapy initial encounter, meaning there's a D, same code with a D for, see, if we were in a room, you guys would all yell it at me. I know you're yelling at the screen. So we have subsequent, and we also have the sequela or late effect. Now, included in this is complications of chimeric antigen receptor or CAR T cell therapy or IEC therapy. And then it said, hey, by the way, this excludes if you have a complication of bone marrow transplant. That's different. That's T86 Th6.0, or a stem cell transplant, different, Th6.5. But if you use T80.82XA, use an additional code to let them know, is this cytokine release syndrome, D89.83, or immune effector cell associated neurotoxicity syndrome, G92.0. Pay attention that D, what does that mean? Yeah, that is a part of the cancer codes are right there at the end of the benign type things that can happen. And then G codes are neuro codes. All right. Now we get into the U code, the only U code that we have. Remember, we had U09, and now we have point 0.9 post-COVID condition, unspecified. COVID-19, let me clarify, because there's lots of types of COVID out there, 19 being the newest one that's been identified. And I put all of this information because it says this code is not to be used in cases that are still presenting with active positive COVID-19 tests, but you can use an exception is made in cases of reinfective with COVID-19 occurring with a condition related to prior COVID-19. So in other words, this was becoming a big deal. People had COVID, and then they were having all of these signs and symptoms related to the COVID that they wouldn't have had. And then we have post-acute sequela or late effect of COVID-19. But if this is the case, then they also want to know, they say code first before UO 9.9, chronic respiratory failure, if they had that, J96.1, loss of smell, R43.8, loss of taste, R43.8. Also, that's the same thing. Multisystem inflammatory syndrome, M35.81, pulmonary embolism, I26, and pulmonary fibrosis, J84.10. Notice J codes are the lungs and respiratory, R codes signs and symptoms, N codes musculoskeletal system, I codes ischemic and heart codes. Okay, very good. Go to the next one. Now we're already into the U codes, and yes, Z11.52, Jane says we use Z11.52 for encounter for COVID screening. And this is people that have already had COVID, and now they're having late effects and sequelas and post conditions related to that. So that's why we'd use that code, this new code in 2022. Okay, Y35.899. A, and I went ahead and put these out there. A for initial encounter, D subsequent sequela. Legal intervention involving other specified means, unspecified person injured, initial encounter. And so for legal purposes, I went ahead and looked it up what medical intervention is, medical legal intervention from the Cornell Law .edu, and it said the term medical intervention means the process by which a physician provides medical diagnoses and direction for medical or surgical treatment options for hearing loss or other medical disorders associated with hearing loss, for example. So again, I thought that was good to note. Z55.5. Yeah, we're already into the Z codes. Now, there was a lot of Z codes, though. None as exciting as someone cutting themselves, like you had mentioned, in obscure ways. But Z55.5, less than a high school diploma. Now, what this is saying, and GED is also classified as the same as a high school diploma. So you don't have a GED and you don't have a high school diploma. They are tracking these two statistics. That's why. And these are very, very interesting. These are going to get put in as MIPS and quality measures, I'm sure, wanting to track this and how it affects the health system for people to have inadequate drinking water, for example. So Z58.6, inadequate drinking water supply. Z59.00, homelessness unspecified. Z59.01, sheltered homelessness, meaning that you're living in a shelter. Z59.02, unsheltered homelessness, so you're living in a place but it's not where people are supposed to be living, like your car. it's not meant to be that. Then Z5 9.41, food insecurity. 0.48, other specified lack of adequate food, which just may be inadequate food or lack of food. 0.811, housing instability, housed with risk of homelessness, imminent risk of homelessness. 812 would be homelessness in past 12 months. 0.819, house unspecified. 0.89, other problems related to housing and economic circumstances like foreclosure on loan, insulated dwelling, problems with creditors. Again, this could really play a part in tracking those F codes with depression and so on and so forth as well. So I think that's great. They've added these. And then they go into Z9 1.014, allergy to mammalian meat, beef, lamb, pork, and red meats. How many of you guys have heard of this and know what causes it, or one thing that's linked to this? And what do you think? I'm really curious is if you know that it's a condition where you could be eating, beef your whole life, and then all of a sudden you're not able to tolerate beef anymore, and it's almost like allergic reaction. It's quite fascinating, and it actually is a result of a tick bite. And so now you're going to go in and do more reading about that, aren't you? Yeah, allergy to meat. So and let's see, it is, yeah, it is a chemical in the meat, I believe. Yeah. And then, but it's a tick bite, and it's not Lyme's disease. I think it's something else. But let's see. Someone asked, when do the codes set to go into effect? It goes on 10/1 every year. So Lisa de Romano, thank you for stating that. The ICD-10 changes go effect on October 1st every year. So now we have that mammalian meat, Z9 1.014, and also 0.51, personal history of suicidal behavior. And that includes parasuicide, self-poisoning, and suicide attempt. And then 0.52, non-suicidal self-harm, a personal history of. So again, goes with that other code that we were um, uh, talking about. All right. Z92.850, personal history of samaric antigen receptor T cell therapy, like CAR T cell therapy. Remember that new code we just added for that. 0.858, personal history of cellular therapy, and that's not cell phone. No. 859, cellular therapy unspecified, and 0.86, history of gene therapy. Now, cellular therapy, that stem cell has been a big thing now. Okay. Oops. All right. On FAC, deleted codes. Let's go look at them real quick. Again, I didn't put these on here because there's just so many of them. So we are going to now, wait, I think Jesus put another, find a code. If you are interested in the encoder that we use at CCO, that the reason I like Find a Code is that they're educationally based. They also have, they're owned by Innova Health, and they're right up there on education, besides the fact they have the same colors as CCO. Oh, I like that too, but that's different. CCO.us/find a code. You can get a 5% discount. They also use our BAT technique. It's actually in the code set that they have in their graphics and stuff. It will make you faster and more accurate, and it helps with denials. They have a really robust risk adjustment platform that I use a lot. So let's go look at what this does. So These are the 32 deleted codes. We're just going to look at them. D55.2. And again, why was it deleted? Most of these are all deleted because new codes were created and expanded to take their place. D55.2, anemia due to disorders of glycotic enzymes. Yes, that's right. We saw that one. And then other intellectual disabilities, F7-8. Now, it does tell you that these carry HCC, so the ones that replace them do too. G92 was toxic encephalopathy, and now we have an expanded our code set for those. Other specified diseases of the esophagus, like the polyps and stuff, 8 K22.8, and it carried an HCC, so those polyps will too, most likely. Thrombotic microangiopathy, HCC, see the little icon there? Low back pain now is more defined. We talked about that. Abnormal findings of neonatal screenings. It's not just P09, it expanded into multiple codes. There's our old R05 cough code. Now we got multiple things. You're going to have to right away go tell your provider about the new cough codes that are available to them. Other polyuria, feeding difficulties we covered, cannabis. All of these cannabises got extended.
Hey, Alicia.
Yep.
I'm going to interrupt you real quick for a quick second. Is there any chance you can make that a little bit bigger over in the top right-hand
Absolutely.
corner? You can actually press Control Plus on your keyboard. I think that should make
Yep.
the text a little bit bigger.
Oh, wait. That was, I hit Control P. Hold on. Wanted to print it. Yeah, let me just. I thought about that. I was looking at it and thinking, I wonder if this is
Actually,
small.
the little ellipses in the top right corner, if you click on that on the browser,
Oh, I'll find my mouse.
far top, yeah, right there. Go ahead and click the zoom button. Make it from 80%. Just bring that up a little bit more so we can see that a little clearer on the screen. Beautiful. Thanks so
110.
much.
You're
That's
welcome.
all right.
Okay.
Bye.
So there's our anemia codes. Let's see, where were we at? There's all those cannabis codes that we did. They expanded those. And look, instead of saying cannabis derivative, now it says synthetic cannabis. Homelessness is now expanded, right? Then adequate food and personal history of self-harm. All of those were expanded. Now let's look at our added. Let's look at changed codes. So 88 changed codes. And it was the descriptions that were changed. So for example, whooping cough. Now we can just go in and look at it. And we're not going to look at every one of these because it's whooping cough due to Bordetella pertussis without pneumonia, or paroxysmal cough due to. And let's look at some of these others. So whooping cough was expanded, the full code description. Sequela of unspecified infectious and parasitic disease. Respiratory, the A and B codes are all your bugs, viruses, funguses, infection codes. C codes are ones that are cancer, right? So malignant neoplasm of the nasal cavity. Let's just go take a peek real quick. So it changed and added better description. Nasal cavity, cartilage, nasal concha, I don't know, internal nose, septum, and vestibule. Very good. Let's see some more. Essential hemorrhagic thrombocytopenia. Cattleman's disease. Did you know what that is? Have you guys ever heard of that? I have. Cattleman's disease, if applicable. And again, herpes virus 8 infection. But it's not Kaposi sarcoma, which is an opportunistic sarcoma. Sickle cell, thalassemia, anemia with chemotherapy. There's this Niemann-Pick disease. They changed the description and we added new codes for that. Acidosis, major depressive disorder. Well, that's very applicable. That's an HCC code. So what they said is single episode major depression not otherwise specified. They changed the verbiage in that just a tad. Okay, then meningitis and other infectious parasitic diseases. Myelitis, nerve root plexus compression, polyneuropathy. That's interesting. That carries an HCC. G63, this would not be diabetic polyneuropathy, but it still carries an HCC. So does congenital myopathy. Let's see all of these. Compression of the brain. We made a bunch of changes with compression of the brain, right? Bronchiosthesis, that just changed verbiage. Let's see, salivary glands. We did get that Sjogren's done. Let's see, unspecified appendicitis description. Again, just giving you an overview of these. There's that verbiage. They short, long, and full descriptions changed for Sjogren's. Sjogren's got a hit with some additional things a couple of years ago. Hypermobility, multi-system inflammatory system. I'm not going to nocturnal uresis, right? Our codes, coma scales, look like that got some more definition. Pain unspecified, dry mouth unspecified. Okay, so there we go. Portuguese man of war. So let's look at the engine. I want to see what they did with that. Obviously, something's happening. Toxic effect of contact with Portuguese man of war, intentional self-harm initially. I thought that said intestinal. I was like, people eat those? Those are toxic. Okay, sorry. Let's see. Portuguese man of war. Wow. Traumatic shock, fall from, W codes, Z codes, encounters with immunization, long-term insulin use. Remember, we knew this was coming. They changed the verbiage just a little bit to with the excludes and to tell us that there is a medication and adding the hypoglycemic drug and oral anti-diabetic drugs. So this was included in the description, short description. A personal history of COVID-19, full description changed. I guess we should look at that one. Excludes post-COVID because that's a new code. Thus, they had to put that change in there. Okay, so now we've looked at those. And just an overview, if you wanted to see how easily they work these out for new codes, and it tells you 159 new codes and when they go into effect until 9/30/2022. And then real quickly, it's real nice to be able to just look at it. Now, how do I find these? If you go to codes, I go to diagnoses or diagnosis. Then I look over here. If I'm going to do my index, I look here for the guidelines. But here's all the new codes for 2021. Here's all the new codes for 2020 year. I can go in and look at past year codes, but you just click on that and then bam, gives me all that information. And we want to see any HCCs. I just look real quick to see if that little HCC icon is there. And I'm not seeing any. Not trying to make you dizzy, but HCCs didn't get a hit. But they did show up on the changed, right? The definitions. So I didn't see a single HCC code in there. But again, I was thinking some of those congenital ones might have. Is this the new? Yeah, added. So very good. Stingray, Portuguese man of war. Compression of the brain, is it different than a traumatic brain injury? Yeah, it is now. Traumatic brain injury, bam, getting hit in the head. Compression of the brain could be caused by different reasons, inflammation, things like that. They'd have. I wish they would add code for never smoked so that all that smoking related encoder edits would go away. You're right. Barbara is right. Yeah. Tony wants to know when ICD-11 is coming. Not anytime soon. Most of the time when you see that, that is just a scare tactic to get you to buy something. If I'm not saying that it's not coming. They are beta testing it in other countries and kind of spot beta testing it here, but don't worry about it. It's I don't think that that's going to be something we have to worry about anytime soon. What's the code for proximal arterial fib with RVR ICD? Well, let me just show you real quick. So you go to diagnoses, index, and what is it? It's an arrhythmia. I can't probably spell arrhythmia easily. So what is it? It's proximal. Let's see. Science. Cardiac arrhythmia unspecified, but it is specified. So here we want, which one did you say? You asked about proximal arterial AFib. I was thinking it was I44.9 was AFib. Yeah, ventricular flutter. Here we go. Unspecified AFib, persistent, proximal tachycardia. Let's see. Let's go look at this one. Proximal arterial fib. But you want it with RVR. So RVR was thinking that with RVR, that's a different code. I think it may be other. Persistent, other persistent. I'm not sure. So let me give you a little tip. This is what you do. You guys think that, let's see. You don't even have to be able to spell it right. RVR, ICD-10, I48.0. That's what I didn't go up high enough. Proximal. That's the one they state it is. Proximal arterial fibrillation with RVR. We have a question at work if we should code D84.81 with Z21 when patient is on meds. Okay, Z21 is HIV positive. D84.81, I don't have that one memorized. D84.81. Immunodeficiency due to conditions classified. Yeah, you can do that. Because they are immunodeficient because they're on medication for their immunity, and because of the HIV positive. Oh, wait. Oh, but this is HIV, this is AIDS, B20, so that's not it. Yeah, you can. But once they get to AIDS, B20, then you're not going to code D84.81. Excludes one. Wait, yeah. So you can do Z21, it says, or HIV positive, but not B20 AIDS, because the disease process has progressed. Okay, guys, I don't want to get into an answer. No, Catalina, D84.81 excludes HIV B20, which is AIDS. It doesn't exclude HIV positive. So that's why if the provider documents contact dermatitis, would you know if it need to be the L24 or the L2 coded fluids? Well, see, now that you've got new codes for that, Sarah, on the contact dermatitis, you need to let the provider know about the new code options so that they can define it. They've never had to give that description before, most likely. And so as doing your provider education on the new codes, you need to let them know that now we have specificity. Let us know what it is, and these are your options. I48.0 is the one I use, but the payers rejected that code. You know what? Leonardo, I'm not sure how to say your name, sorry. Go put that in the CCO club. I'll go investigate it, because I know there is a code for RVR with AFib. It's just at the tip of my brain, and I can't remember now. The encoder said or that was Googling it. That I didn't go in and look and see what the options were and everything. But I know we've talked about this. I know I've done a video on it, and I just can't remember when and where and the details. So I'll have to look that up for you. Yeah. You're welcome, Jane. We love doing this. We want to support our coding and billing and medical community in any way we can, and this is a great way for us to give back. It's a lot of fun, and it educates all of us. The whole team gets educated in the meantime with your great questions that you give us. So we enjoy what we do. We're passionate about it. We want to make sure we're giving valuable education. We want to give uh, 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 value-based content at a good price, so that it's not a inexpensive realm to get into, but with minimal investment, it really pays off. Yeah. Hey, I am not that smart, Claire. It is just because it's something I like. If I didn't like it, I would not be that smart. When you read about it all day long. Right? All right, you guys, we really appreciate it. Don't forget, if you haven't hit that thumbs up, do so, because that's how you can tell us that you appreciate it. That helps us. That helps us get in the little search engines and all kinds of algorithms that I have no idea what they mean, but they do mean that our information and product and content reaches more people, and that's the goal. We want to make sure that we are getting this out there to the people so that it's beneficial to them, and also to let us know what kind of content that you want. So we'll do another webinar soon on the new guideline changes, and because that's a lot of fun too, but we couldn't do both of those in one night. We're already pushing it 2 hours. I think the last time we did this, we did it in 4, because there was a whole lot more codes, and so again, I've never had a trouble talking, but I've rubbed off all my lipstick. It's time to go in for the night. Okay, guys. Thanks. Don't forget, you can share this too. Go out and share on LinkedIn, with Facebook, and YouTube. See if you can help some other people. Oh, if you want to be notified, there you go. Live event, cco.us/notify. If you want to know every time we do we air something. That'll give you, or click that little bell thing. I think it dings or does something and lets you know when we're going to do something. We seem to be here all the time. Bye, guys.
Do you need more medical certification and business training? Learn more at www.cco.us.